high level, like what is PCOS, and then maybe some common things that maybe someone should press into a little bit that could help maybe address some of those symptoms too.
Yeah, so PCOS stands for polycystic ovarian syndrome. And so there is diagnostic criteria that one usually gets from going to their OBGYN. We generally see hyperandrogenism, so high levels of testosterone in women versus a normal, healthy woman. We see cysts in the ovaries, usually like a string of pearls if we're getting ultrasounds. We also have symptoms of like hair loss sometimes, chin hair growth, like places that we don't want it, acne. And then 70% of PCOS cases are insulin resistant. So we see a lot of, pre-diabetes, potential to turn into diabetes. What it's been sold as is a gynecological reproductive issue, but what it truly is a metabolic system issue. It's a whole cholesterol, like the whole body is generally going through this type of like metabolic syndrome issue. And so a lot of women don't even know what kind they have when they get told from their doctor. They just assume it's insulin resistance. And I hope they're running labs, but not every doctor is running labs.
Sure.
There are 4 kinds. There's insulin resistant, which most women are, adrenal, which is caused by lots of stress. Those clients won't even be overweight usually. They might be underweight or fit. You'll have inflammatory PCOS, which I've personally worked with. That's a lot of food intolerances and just high inflammatory markers. And then post-pill, which a lot of women do get as well, because we're coming off birth control. All of our, especially oral birth control, a lot of our estrogen and progesterone has been suppressed for so long that androgens kind of take over for that 6 months of coming off the birth control. So we just get those unwanted symptoms. And, it really sucks for a lot of women because there's not really a lot of answers in Western medicine. They put them on birth control to normalize their cycle.